Hey guys, Tierra here with Doctoral Fitness, and today's video is all about my NICU rotation. If you're new to my channel, welcome. I'm Dr. Tierra Range, a new pediatric resident who makes videos on medicine, lifestyle, and fitness. If that sounds like something you like and you want to see more, make sure to subscribe to my channel so you don't miss another video. So this video is coming a few days after my normal upload day because residency is starting to pick up a little bit, as to be expected. But I'm so happy to finally let you all in on how my last rotation went, as I just finished NICU on Sunday. For those of you who don't know, NICU stands for Neonatal Intensive Care Unit. It's basically an ICU for neonates, or very young babies. As you can imagine, any patient in an ICU setting is a patient in a much more critical condition, and they require a lot more intensive care. Hence the name. These rotations are notoriously a bit more difficult than other rotations because you're working with many different machines and there's a lot of math involved. But I learned a lot in the last month, and it's honestly been one of my favorite rotations so far. Let's start off with the basics of the NICU setting that I was learning in for the last month. So the NICU at my hospital is separated by levels. And at the specific hospital I was doing this rotation at, there were 3 levels to this NICU. Level 1 is considered the newborn nursery. And that's where any baby goes while mom is recovering in the hospital for the first 48 hours after a delivery. And during that time, a physical exam is done on the child and routine labs and vaccinations are performed. Since level 1 is just full of newborn babies, it's not considered to be a part of the NICU. Then we move on to the level 2 NICU, or the nursery intermediate care. This is considered to be a part of the NICU setting because these babies require a little bit more management and require vital signs to be taken on them at least every 4 hours because they are in a little bit more of a critical state than a baby who is in the newborn nursery. These babies require a mild form of intensive management, involving things like receiving IV dextrose or sugar water whenever they have low blood sugars out of the womb, or maybe phototherapy if they suffer from hyperbilirubinemia or high levels of the compound bilirubin in their blood. Then after level 2 NICU, we move on to level 3 NICU. And the level 3 NICU is probably what you think of if you were to think of a neonatal intensive care unit. These babies are usually very premature, or they are term infants, meaning they were born at term, but they have some kind of critical condition requiring the use of multiple different machines. While on this NICU rotation, I worked both in the level 2 NICU and the level 3 NICU. Okay guys, now that we understand the different levels of NICU and we have a better understanding of what happens in each level, we can talk about my schedule for this last month. So I won't get into the specifics of short stay days and late stay days because I have a video about that you can click up here if you want to watch. But just know that similarly to all of my other rotations, I had several short stay days, several late stay days, 1 day a week where I went to clinic in the afternoons, and 1 week of nights. I spent 2 weeks in the level 2 NICU and 1 week in the level 3 NICU. And then when I was on nights, I was serving as the intern covering the newborn nursery and the level 2 NICU. While my short stay days were very similar to short stay days on any other rotation, my late stay days were a little bit unique. I would be given a pager on my late stay days and also on the week when I was working nights. And on these days, if the pager went off, that meant that the neonatology team was called to a delivery, and myself, an upper level resident, and a fellow would immediately stop what we were doing and go to a delivery. Based off of what was happening in that delivery, if a baby required resuscitation, I was required as the intern on the service to take the child to the resuscitation area, resuscitate the baby, and then afterwards decide what I felt like the baby's APGAR scores were. APGAR is an acronym that stands for appearance, pulse, grimace, activity, and respiration. And it's basically a way that physicians use to measure how well a baby is doing just after a delivery. Based off of my assessment, I would create an APGAR score for a baby at 1 minute of life and at 5 minutes of life. And if a baby had low APGAR scores, required a significant amount of resuscitation, or had any other critical issue, Then after the baby was born and I finished my resuscitation, I would admit that baby either to the level 2 NICU or the level 3 NICU. Every baby gets an APGAR score, and that's usually given to the baby by the team of physicians who are present at the delivery. I, as the intern covering the neonatology service, was only required to come up with APGAR scores on babies who may have to be sent to the NICU. In addition to this, I would take any new admissions that were coming in, and I would be responsible for any discharges that happened whenever the short stay resident left for the day. Although this unique quality of the NICU rotation late stay days and week of nights required a lot of responsibility for the intern who was covering those shifts, I am so appreciative of the opportunity to have done that because I learned so much just being thrown into the mix and seeing many different babies with many different conditions, many different critical situations, and it was really beneficial to my learning to be a part of the decision-making process for a lot of issues on the spot. If I could come up with one favorite part of the rotation, it would have to be discharge day for any baby in the NICU. In the era of the pandemic, it's very hard to allow mothers to continually come back and forth to the hospital to visit their children because of restricted hours to keep the babies, the team, and the mother safe. It was always such an amazing feeling to see babies and moms reunited so they could begin the bonding experience outside of the hospital setting. A few tips for anybody who's about to start a NICU rotation would be to number 1, work on calculating your APGAR scores and make sure that you can calculate them quickly. As I said, you have to provide an APGAR score for these babies at the first minute of life and the 5-minute of life mark. That first minute of life comes around very quickly and you don't have that much time to provide your assessment. So make sure to practice different case settings and try to come up with your own APGAR scores and test yourself to see if you are correct. I'll include a link below that will lead you to a website with many opportunities for you to practice this. Another tip would be to study up on the most common presentations to a NICU setting. Some common ones to read up on for a level 2 setting would be things like a baby who may require a limited sepsis evaluation after the mother developed an infection within the first 24 hours after delivery. Another one could be an infant of a diabetic mother who requires management of hypoglycemia, low blood sugar. A final very common presentation to a level 2 NICU setting would be a baby with hyperbilirubinemia, which I mentioned earlier, which would require phototherapy and further workup. For a level 3 NICU setting, a baby could be there for a myriad of reasons, but most importantly, if I were you, I would look into infants who are premature and what that means based off of how premature an infant is. It may also be beneficial to you to look up the different types of machines that are used in a level 3 NICU setting. But that's pretty much it, guys. Those are the ins and outs of my last rotation in the NICU. Have you worked in the NICU before? What were your favorite parts? Are you interested in NICU and want to learn more about it? Make sure to let me know in the comments below. If you liked this video, make sure to give it a big thumbs up. If you have any questions or just want to chat, make sure to let me know in the comments section below. And if you like videos about medicine, lifestyle, and fitness, then make sure to subscribe to my channel. I'll see you next time.